My name is John Hayden Hancock, and I'm in nursing 1119.
I wrote until they provide normal, whatever normal.
Come in. Good morning, Miss Kaylin. I'm John Hayden Hancock. I'm going to be your student nurse today. Before we get started, I'm going to provide us some privacy and hand hygiene.
Okay.
Do you mind just verifying your name and date of birth for me?
Kaylin Madison, 08-2701.
Okay, sounds good. So I've reviewed your vital signs and I've assessed for any allergies through your patient record, and I've been informed by your physician that we're just gonna be assessing you for multiple different tests today. Okay, so before we get started, do you have any questions or anything that I can do for you?
I do not.
Okay, so let's begin with our Nero assessment. So, do you know where we are right now?
I'm at East Mississippi Community College.
Okay, and do you know what month and year it is?
It is March 2021.
Okay, so I've assessed my patient's level of consciousness, and her mood and affect are correlating with that, so that is a good sign. Okay, Miss Kaylin, do you remember what you had for breakfast this morning?
I don't eat breakfast, but I did have some coffee.
Okay, and do you remember what high school you graduated from?
Starkville High School.
Okay, that is good. Next, we're going to moving on with a couple of different tests, so if you don't mind standing up for me, please. You could just take 5 steps towards me and then 5 steps back. Okay, so I was assessing your gait, which that is normal, and her arms are symmetrical, which is great. Next, we're going to be standing still and put your heel to your shin, and then just move it down. And the other one. Perfect. Next, we're going to be doing the Romberg test, so you would just stand still and close your eyes, assessing for any balance or any unbalances, which is good. Okay, so that was good. Now we're going to move on to your cranial assessment. Can you sit down? First, we're going to be assessing cranial nerve number 1, which is your smell. And my patient were not to know, but I'm going to have an alcohol pad right here, and she's just supposed to identify the smell that she smells. Okay, Miss Gallon.
Alcohol.
Okay, next we're going to be testing cranial nerve number 2, and that is vision. So what we would do is have Miss Kaylin close one eye, look into a Snellen chart, and then do the same with the other and look into that chart as well. Next is we're going to be assessing cranial nerves 3, 4, and 6. I'm just going to be using my pen light. You can look at an object behind my shoulder. I'm going to be assessing those pupils. And then over here. And she does have a bristle dilation, which is also normal. Next, if you could just follow your eyes, keep your head towards me. Very nice. Good job. Next, we're going to be assessing number 5. And if you could just close your eyes, I'm going to touch an area on your face, and you just identify where that's at. Good job. Next, we're going to be assessing number 7, which is your facial structure. So if you don't mind pulling your mask down for me, smile, frown, raise your eyebrows. You can just blow your cheeks out. Perfect. Okay. Next, we're going to be assessing cranial nerve 8, which is the ear. So what I'm going to get you to do is hold one ear. I'm going to whisper, and you just repeat that. And we're going to do that on both sides. Hold one.
1, 2, 3, 4.
And then this one.
A, B, C, D.
Okay, good job. Next, we're going to be assessing 9 and 10, which is her soft palate. So if you don't mind opening your mouth for me and saying ah. Ah. Looks good. Next is number 11. And if I'm just going to press right here on your shoulders, if you lift up. Okay. And I'm going to put my hand on your face. You just turn towards my hand. Okay, other side. Perfect. And then last one is number 12. Just stick out your tongue for me. Perfect. Good job. Okay, now we're going to move on to her abdominal assessment. So before we get started, I'm going to ask you a few questions. Do you have any history of kind of anorexia or any kind of eating disorders that weren't mentioned?
I do not.
Do you have any interest or disinterest in like excessive food or not enough food or anything like that? No?
I think my eating pattern is pretty normal.
Good. Any food intolerance?
Just to dairy.
Okay. And any symptoms of constipation or diarrhea lately?
None.
Okay. When was your last bowel movement?
Last night.
Okay, perfect. So if you don't mind just laying down for me, please.
Okay.
First, I'm going to be inspecting for any kind of redness, lesions, or any kind of abnormality, scarring, or anything like that, and she is good. So next, I'm going to be auscultating all 4 quadrants. And I'm going to be starting with the right lower, and I'm going to move clockwise. And I would listen for 5 minutes or until I hear bowel sounds, in which I do. So I'm going to keep going. Okay. Next, I'm going to be listening with the bell of my stethoscope for any bruise. And that sounds good. And then lastly, I'll just be palpating lightly on all 4 quadrants for any kind of distension or tumors, any kind of swelling, tenderness. Are you okay, Miss Kaylin? Good. Okay, you are good to go. Next, we're going to be assessing for her muscular strength. So what I'm going to have you do, I'm going to place my hands right here, and you can just lift up, hold your hands out, push towards me. Very nice. And then I'm going to press right here, and you just push up. Very nice. Also, I'm going to go ahead and assess down here. I'm just going to put pressure towards your ankles, and you just push towards me. Very nice. And other one. Good job. Now we're going to move on to her sensory perception. So I have here is my cotton applicator. If she were not to know this, I'm going to get the patient to close her eyes. And if you can feel this soft touch, please let me know.
Yes. 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 Yes.
Okay, good job. Now we're going to be doing pinprick test. So we're going to have that soft applicator and then a pointy end as well. And if you could close your eyes again and see if you can identify which end I am touching you.
Soft. Short. Short. Sharp.
Okay, good job. This is our last test, and it's going to be our muscular skeletal assessment.
Okay.
So what I'm going to get you to do, we've already assessed your normal gait, which is normal in the Nero assessment. But if you could just bend down like this, I'm going to be palpating her spine. That seems normal. Okay. And then I'm just going to be palpating her upper extremities as well. That seems good. And then while I'm here, I'm going to be listening to our pulses bilaterally. And those are normal. I'm going to be palpating her lower extremities as well. And I'm going to be checking both pulses. And then I'll get Miss Kaylin to take off her shoes. And I can feel her pulse, but if I were not, then I would get the patient to take off her socks. And those are strong. Next, if you could just follow my instructions, you just do what I'm doing. So we're going to make small circles, testing her range of motion, and then backwards. So make those big circles, and then backwards. Very nice. If you could just stand up for me, please.
Okay, for the
Extend your leg out.
and then you do the second to the left.
And
I don't know
back.
if you're gonna do it all.
Out and back. We're gonna make those circles once more. Back. And then if you can just press the gas pedal, put it down, and up again. And then same one. Also, down, and then let's get your wrists. Thumbs out, down, up, and other one. Very nice, Miss Kaylin. Okay, so I'm going to get you in a comfortable position before I leave. Call light within reach. Just press it if you need me. Is there anything else I can do for you before I leave?
That is it.
Okay, now I'm gonna get my videographer to scan the room. Okay.